Good afternoon, everybody, and welcome to another virtual town hall. I'm so grateful that you're here, whether you're watching us on Facebook or Twitter or YouTube or on our website. We hope that this is an informative 90 minutes or so. We've got a couple of amazing guests this week, and I want to get right to introducing them. First with us today is Greg Yasko, former chairman of the Nuclear Regulatory Commission, and also the co-chair of our San Onofre Nuclear Generating Station Task Force that produced this outstanding report. Recently, Greg served as chairman of the Nuclear Regulatory Commission from 2009 to 2012, and as a commissioner from 2005 to 2009. As chairman, he helped play a lead role in the American government's response to the Fukushima nuclear accident in Japan. And he's now an adjunct professor at Princeton University and Georgetown University, and an entrepreneur with a clean energy development company. Greg, it's great to see you.
Well, thank you. It's great to be with you virtually.
Thank you for joining us. And for those tuning in for the first time, we are honored, as always, to have back our dear friend, Dr. Carl Steinberg. Dr. Steinberg is a leading nursing facility and hospice medical director in North County, San Diego. He earned his bachelor's degree from Harvard, went to The Ohio State University College of Medicine, and completed his family medicine residency at UC San Diego. Dr. Steinberg, it is great to see you. And as I just mentioned before we got on the air here, this is your 9th virtual town hall with us. So my gratitude to you, sir, for all your good work, and you're helping us understand the ins and outs of COVID-19. Great to see you.
It's a pleasure.
Well, thanks again, and I'm very grateful for all who are watching, and it's been now a little over a week. I hope everybody had a healthy and happy 4th of July weekend with your loved ones, and if you weren't able to be with your loved ones, I hope that nonetheless you had as good a weekend as you possibly could have had given the circumstances. And the circumstances right now are daunting for the United States, specifically as it pertains to COVID. Very sadly, our country has passed the 130,000 mark of those who've lost their lives, and we're all shaken by that statistic, as well as very prayerful for those who've lost their lives and their families and loved ones. The numbers now 3 million plus cases in the United States, 131,857 deaths. In California now, 284,000 cases and counting. 6,575 deaths. San Diego County, 17,578 cases and 399 deaths. And Orange County, 18,892 cases and 369 deaths. Over the past 2 weeks, we always try to share the information over the recent history. OC has recorded 7,287 new cases and has reported 97 deaths. San Diego County, 5,904 new cases and 49 deaths. And of course, as we mentioned before, that's despite the fact that San Diego County continues to test significantly more people than Orange County. So we continue to be concerned by the lack of testing in Orange County. We'll continue to work diligently on trying to address that in the weeks and the months ahead, particularly testing for the asymptomatic population in high-risk environments such as our nursing homes, where we know a lot of that community spread is occurring. And I know Dr. Steinberg will be getting to that. With cases spiking throughout the West and here in California as well, though maybe not as bad as in some other states, but nonetheless, Governor Newsom has had a targeted approach, shutting down bars again and movie theaters, other indoor gatherings, and encouraging outdoor options for dining. And there are other cases like Imperial County where he's needed to take more restrictive measures than that. I hope that doesn't happen in Orange County and in San Diego County. And I want to encourage everyone again, follow the steps we know can help control community spread. That means wearing a mask. It means prioritizing outdoor venues over indoor spaces, keeping 6 feet from one another, not touching your face, and washing your hands. Very simple things that we can all do. My hope, as always, is that we can have a healthy economy, but we cannot have a healthy economy unless we have healthy people. And that's what we've got to prioritize. As I mentioned in our past virtual town halls, and we've now been doing these since the middle of March, Congress has passed a number of major bills to deal with COVID-19. And I'm very eager to get a fifth bill across the finish line sometime later this month. We head back to Washington around the 20th. We'll be there through the end of July on into the beginning of August. I'm very hopeful we can work with our colleagues in the Senate and get another bipartisan comprehensive relief bill across the finish line. It began on March 6th, our first effort, $8.3 billion for the development of the vaccine. I'm encouraged by everything I'm seeing and hearing with regard to the development of the vaccine. We now know over 160 companies are working on this, including many of them in our region, and I'm very happy about that. We, on March 18th, passed the Families First Act. That included emergency sick leave and nutrition assistance, as well as Medicaid support. Then at the end of March, we passed the CARES Act, $2.2 trillion in relief, both through the Paycheck Protection Program, direct cash assistance up to $1,200 check to individuals, and the expanded unemployment insurance. Importantly, that expanded unemployment insurance ends at the end of this month. And clearly the pandemic has not ended, and our response should not end either. Then on the public health side, of course, billions and billions of dollars for everything from PPE to our hospitals, to our testing, and we still have to do so much more with regard to testing and with regard to contact tracing, because we know that really is the way to continue to reduce the spread, to build public confidence, and to get things moving again. The Paycheck Protection Program, we know, has had a mixed reputation, to say it mildly, but we also know that we've taken steps to try to improve upon the methodology, the way the money is lent. We've done a lot around community-based lending, and I'm proud to report that over 20,000 small businesses in the 49th District have received PPP funds. It's $613 million that has been received in our district, and it's supported over 241,000 employees in the 49th. And I'm thrilled that so many employees in our district were helped by this, but we've got to be pushing for more openness, more transparency, more accountability to ensure that only the businesses that really need the help are getting the help. We also most recently passed the HEROES Act, and this is what's sitting on Mitch McConnell's desk. And we passed it now well over a month ago, and it has a lot of important provisions in there. $875 billion for state, local, territorial, and tribal governments, including of that, over $300 million that would come to the 49th Congressional District. That's why all of our mayors, Republicans and Democrats alike, joined me in that effort to try to get that money for state and local government. And particularly now where we see this renewed push to try to reopen schools. Remember, that costs money. That costs more money. And we're asking schools to do less, to do more rather, with less money. And that's simply not a sustainable course for our schools, for our teachers, and for our children. And we need to do everything we can to make sure those resources are there for all of our frontline professionals, for our schools, for firefighters, police, you name it. We also, in the HEROES Act, we included $100 billion for low-income renters. We included hazard pay for frontline workers. Importantly, we included $25 billion for the U.S. Postal Service. And it's so critically important that we do all that we can to save the U.S. Postal Service. They employ over 630,000 Americans, including over 100,000 veterans. That's why I helped lead an effort of 137 of my colleagues to leadership demanding that we provide a lifeline to the USPS. And I'm very grateful that now has, I think, a lot of momentum. And look, I don't expect for Mitch McConnell to agree with every word of this massive bill. It was over 1,800 pages. But what I do expect that he is not going to take a pause, that he's not going to say states should go bankrupt, that he's actually going to get something done for the American people, and he's going to negotiate with us, that he's going to offer their version of COVID-19 relief, and then we can work together as we historically have done throughout this process on a bipartisan basis to pass this fifth relief bill. We've got more than 130,000 people who have died of COVID-19. And just because certain people think it's going to disappear, it's still very real. And we are living it every single day. There is no sign of this virus slowing. If you saw Dr. Fauci's recent comments, he said we are still in the first wave of COVID-19. Of course, Dr. Steinberg can speak to this, but the other thing that is very troubling to me is that in the middle of this healthcare crisis, there are those actively trying to dismantle the Affordable Care Act. And at a time when families need affordable healthcare more than ever, many have lost their employer-provided health insurance as a result of job losses. In fact, we know that over 500,000 people have now tried to sign up for the ACA in recent months. And at that very moment, the administration is now back in court trying to dismantle the ACA. Over 47,000 people in our district alone rely on the Affordable Care Act. And I won't even talk about the over 130 million people in the United States of America who would be at risk of losing their care if protection for those with pre-existing conditions would be eliminated. It's just unconscionable to me. And in direct contrast to that, last week in the House, we passed the Patient Protection and Affordable Care Enhancement Act, which would strengthen and protect the Affordable Care Act and Medicaid as well. So it's so important that we move forward on a positive basis and try to strengthen and improve healthcare. The alternative of stripping Americans of their healthcare during a global pandemic, it's not only irresponsible, it's just flat out heartless. And we're going to do all we can to stop it. I wanted to highlight some local environmental issues, working our way towards the SONGS report, San Onofre report. At the end of June, I announced a $11.5 million grant from the U.S. Department of Transportation for the stabilization of the Del Mar Bluffs, critically important for our region. It'll help install subsurface drainage, concrete channels, storm drains, support piles, and much more. A few months ago, we were able to help secure $300 million as part of the U.S.-Mexico-Canada trade agreement to address the problem of cross-border pollution. I am actively working, my office is actively working with the U.S. EPA and other stakeholders to try to identify the best projects and to get rolling as soon as we can. And I'm very grateful for the bipartisan support that we've had on that. Earlier this year, we announced the U.S. Army Corps of Engineers had allocated planning, engineering, and design funding for the Encinitas-Solana Beach Coastal Storm Damage Reduction Project and the San Clemente Shoreline Project. And just this morning, we had a stakeholder meeting with a number of our local elected officials, California Coastal Commission, representatives from the state legislature on moving forward with all those coastal protection projects throughout our district. Finally, before I get to San Onofre, I'm really excited that this past week, finally, we announced and released the House Select Committee on Climate Crisis Action Plan. It is a bold and comprehensive 538-page plan. I am very honored that 7 of my bills wound up in that plan. It's going to set the United States on a zero net carbon pollution course by 2050 or sooner. It's going to save over 60,000 lives per year to reduce air pollution and will save nearly $8 trillion at minimum by 2050. And that doesn't even include the savings from energy savings as well. Also, last week, we passed in the House a major infrastructure bill, H.R. 2, the Moving Forward Act, which included 3 pieces of my legislation to invest in America's infrastructure to create jobs. It's long past time we make a robust investment in our nation's infrastructure, particularly at this moment when we have so many million Americans who are out of work. We can put them back to work with great public works projects, among other endeavors that we will move forward on. But nonetheless, infrastructure can play a critical role. And I'd far rather that we act in this moment as the FDR of our era rather than the Herbert Hoover of our era. So count me in for major infrastructure investment. The Moving Forward Act includes the bipartisan bill I authored to expand renewable energy development on our public lands and an amendment that I authored allocating $3.4 billion for VA infrastructure upgrades and prioritizing specifically service-disabled, veteran-owned small businesses to complete infrastructure projects. And I'm really excited about that. 2 other areas with our veterans. One is the Homeless Veteran Coronavirus Response Act. That'll hopefully help a lot of our homeless vets and those at risk of becoming homeless. And the second is the Veterans Economic Recovery Act, We know that as a result of COVID, the veteran unemployment rate has roughly quadrupled. And to try to address that, our bill, which is a bipartisan bicameral bill, would create a new rapid retraining fund, 12 months of educational benefits for high demand occupation training for our veterans. I'm very hopeful that both of these will pass, not only the House, but I hope the Senate, and will become law in the months ahead. I'd also like to mention the Justice and Policing Act. Many of you know that we passed this in the House recently, and I stand with millions of Americans across the country demanding accountability and comprehensive reform to a system that has allowed brutality and injustice against people of color for generations. And for far too long, we failed to act. And the Justice and Policing Act will help bring about the long overdue change we need. And we must ensure that those like George Floyd and Breonna Taylor and so many others are not forgotten. We can continue to do that by pressuring the Senate to take up our Justice and Policing Act. And just as I mentioned about the HEROES Act, I don't expect the Senate to agree with every word and every page, but I do expect them to mark up our bill, to hold hearings, and ultimately to work with us on a bipartisan compromise. And my great hope is we use this opportunity to whatever extent we can to create a new normal that we can all be proud of. Finally, turning the songs to San Onofre, I was thrilled to see this amazing new report. The San Onofre Nuclear Generating Station Task Force report. It's around, what, Greg, around 70, 80 pages, something like that, and a whole bunch of technical material to support that work. And as many of you know, I formed the San Onofre Task Force in January of 2019. We had two amazing co-chairs that agreed to participate in former NRC Chairman Greg Yasko and retired Rear Admiral Len Herring. They've done an extraordinary job. This really has been a project, a labor of love for Greg and for Len and for everyone involved, and really countless others throughout our community. And we are all quite concerned about not only the 1,600 tons of waste at San Onofre, but really spent nuclear fuel throughout the United States. The task force made 30 policy recommendations, many of which have a federal nexus. There is a ton more to do in the months and years ahead, but this is a great start. And I'm thrilled again to have Greg, our co-chair, here with us today, and would love it if you could say a few words on the release of this report. Greg, the floor is yours.
Well, thank you very much, Congressman. And the first thing I'd say is that I want to thank you for launching this effort. I think this is a very, very challenging and difficult issue, and it's really going to take sustained and continued leadership like your leadership to make progress on this issue. And I was really fortunate to be involved in this, to work with over 30 people from the community, many with varied backgrounds and varied levels of experience. And what I was really thrilled with was the way that we were able to come together and develop, as you said, 30 recommendations on these number of findings that we had. And they, I think, are very unique in many ways. One of the unique ways is that they address not just the federal government's responsibility, but things that can be done on the part of Edison, on the part of the state. So it was really a comprehensive look at all the things that need to be done to fix this problem permanently, really, for the community in and around the San Onofre plant. But I think one of the really nice features that came out of it was that a number of the recommendations had implications for the more than 60 communities across the country that will suffer the same kinds of challenges that folks outside of songs are dealing with. What to do with this legacy fuel, how to properly store it and maintain it, how to make sure that the right kinds of decisions are being made to protect the fuel and ultimately to protect the community. So, it really was a pleasure to work on it and to be involved with all the people and to see their passion and their commitment to making some real progress on this issue. And we had a number of findings in different areas dealing with very technical things related to the storage and handling of the fuel, very high-level policy kinds of issues for both the federal and state government. And then one of the unique things we did is we looked in other areas, whether nuclear or related fields, to see what their best practices are. And we came up with a number of best practices that are used in other countries and in other programs with similar kinds of material. And again, I think those are some of the unique aspects of this report. And I encourage everyone to read it. It's not perfect, as I've heard you say many times, but I think it's really a tremendous first start, and something to build on and continue to refine and improve as hopefully as changes are made and recommendations are implemented, we can refine it and continue to move forward.
Well, Greg, I'm very, very grateful to you just for really going above and beyond in a voluntary capacity to make sure that we really got this report right. And it's an outstanding piece of work. It reflects your dedication as well as many others who participated. And I'm just so grateful to my staff, specifically Jonathan Gilbert and Kyle Crail-Frolander, who may or may not be watching. Hopefully they're both watching right now. But very grateful to them. Just did a wonderful job helping to bring so many people and so much of this together. And we now have our homework. There's a lot of things in here that our office will be leading on. 8 specific recommendations of the 30 or so that the task force developed. Really, there were 8 areas where I saw a direct federal nexus, and we're going to get to work on those. We already have done one of them, which is the introduction of the Spent Fuel Prioritization Act, HR 2995, which just says for all the nation's nuclear waste, once we figured out where we're going to move it all, whether it be an interim site, a geologic repository, or both, move the waste first from those sites that have the highest seismic risk and the highest population density. And not surprising, within 50 miles of San Onofre, there are earthquake faults, and there are 9 million of us. And so we finish really at the top of that list. It's not something I like being number one at, having the most at-risk nuclear waste site in the United States, but nonetheless, that's where we are. So that bill will help accelerate the removal of the waste once we find a place to send it. So thank you, Greg, for all your hard work. We do have some questions from our audience on San Onofre, so stay tuned. I'd now like to turn it over to Dr. Steinberg. Doctor, it has been quite a period in terms of COVID-19. Obviously, we're seeing a lot of concerning signs out there right now, but I wanted to get, as always, your view of where we are and really where things are headed. So, Dr. Steinberg, with that, the floor is yours.
Thank you, and I want to thank both of you and the entire task force for the great work you're doing, about San Onofre. That's much appreciated, I'm sure, by all of our constituents and everybody in the general geographic neighborhood. So thanks for that. I'm thinking back to the first town hall I did. Maybe it was back in March or something like that, and I would have pictured that by July things would be a lot better, and that we would have been over the hump. And as you alluded to, Dr. Fauci recently said, I think the exact scientific term was knee deep in the wave. And I'm really sad to report that things do not seem to be getting appreciably better. And, if there's one message for everybody today, it's just, hunker down. We're in this for the long haul. I think there's been some, and let me just preface all this by saying I'm speaking on behalf of myself, not on behalf of, Hospice by the Sea or Life Care Center of Vista or Carlsbad by the Sea Care Center, or Mariner Healthcare, or Scripps, any of the people that I work for. It's strictly coming from me, but I've been, I'll just say, disgusted by some of the politicization and some of the irresponsible statements that are being made. And, let me just assure people, and I hope that most of our constituents believe in actual facts and science. COVID-19 is not 99% harmless. I think it's clear that even though we've been hearing lately that the death rate is not that bad, right? And it's true, the death rate has not been that bad. We have figured out how to treat it to some extent, and so people are surviving. But a lot of people are still dying, and those that survive, many of them who had severe illness, are going to have long-term consequences in various body systems, not just the lungs. So when you hear that people are having COVID parties or, going taking the 17-year-old daughter to a church service where she contracts COVID, and then treating them at home with hydroxychloroquine and azithromycin, and then dying. Those are really tragic stories. And I think when the message from the top is really don't worry about this, we got this, no biggie, that's disgusting to me. That's I'll just leave it at that. As far as San Diego County, it's been disturbing. Last town hall was, I think, 2 weeks ago, and we were a little worried because we had a couple of days with over 300 new cases a day, and we had our highest percentage yet, which was, I think we had a day that was 5% of the cases of the tests positive, and a day that was 7%. Well, since 2 weeks ago, things have gotten a lot worse. Yesterday, we broke a new record. We had almost 600 cases in one day. 10% of the tests were positive. So community spread is happening. It's happening probably in part because we opened things up too soon and people were not taking appropriate precautions. The 3 nursing homes where I see patients up in North County still have had no active cases among any of the nursing home residents. But I don't think that'll be the case for long. I think it's coming, and it's been devastating in nursing homes, and I'm afraid that with the amount of community spread that we have, it's going to be impossible to keep it out. So I hate to be overly pessimistic. I'm very much a glass half full type of guy, but I'm worried about that. And since I'm talking about nursing homes, because that's normally where I hang out, it's been extraordinarily difficult for people to not have the ability to visit family members, to have visits from their family members. And there's a big push right now to open up visiting. And I hate to say it, I just think it's the wrong time to be starting to do that in our county right now. And just urge people to try to be patient. And that's about it. But main message, this is not the time for us to let up. Things are going to get worse before they get better with respect to COVID. And so I just hope everybody is able to, continue the long haul here and continue to do the right thing. Thanks.
Thank you, as always, for your insight, Dr. Steinberg. And it's concerning times indeed. We have a lot of questions. I want to get to as many of them as we possibly can. And I'm going to start with Greg in Carlsbad. It's a question for you, Dr. Steinberg. Last week, my wife and I got tested for COVID-19 antibodies. Before the blood draw, the doctor explained that COVID-19 antibodies do not persist very long, saying testing us would probably yield a negative. Not the case for us. We were tested at 10 and 7. If the antibodies diminish, then isn't one susceptible to reinfection? Secondly, will this make it more difficult to develop an effective vaccine? Can you use your resources to verify that antibodies are short-lived?
Well, Greg, that is a lot of question right there. And I'm going to try to answer it the best I can in just a few minutes. But basically, antibody testing will show that you have been exposed to the virus and that your body has created antibodies to it. Normally, we test 2 types of antibodies. There's one called IgM that tends to go up a little bit more quickly and then go back down. And then there's one called IgG that tends to take longer to develop and tends to last longer. So with COVID, if you got exposed to COVID a week ago, in 1 week, you might have about a 25% chance of being positive for IgM. And over the next several weeks, that'll climb quite a bit. But it takes a while for the antibodies to develop. Now, with a lot of illnesses, you get your antibodies, your IgG, and they'll stay in your body so that you'll recognize it next time. So far, the research with COVID-19 suggests that particularly for people who do not have severe symptoms, those levels can go down pretty rapidly. So they go up a little bit gradually, and then they come back down. And so some people who did have asymptomatic disease but were documented as having it will have no detectable amount of IgG in a matter of a few months. Now, does that mean that they will not have immunity? Ordinarily, I'd say probably yes, but there's a lot of mysteries around this virus. And, normally we would say that similarly, if you had a high level of IgG, then you would be immune to it. We're not even really sure about that at this point. So they are using immune serum, right? They're using convalescent serum for people who've gotten over it, who have high levels of the antibody to treat it. It does appear to be somewhat helpful in killing off the virus. But in any event, antibody tests are not generally recommended because it's not going to really tell you if you have it now. And we're not sure if you're positive for antibodies that you're really going to be immune. So for sort of epidemiological, research reasons, testing the prevalence in the community, it may be good to know. But don't feel like it gives you sort of an immunity passport or something like that. I'd recommend holding off on that until we know more. And as you can imagine, research is going on frantically right now. Vaccines are in development, lots of them. I'm cautiously optimistic that by early part of next year, we'll have something that is at least somewhat effective. It may turn out to be like the flu vaccine, where it's not a perfect fit, and it's not going to give you complete immunity, but it's going to make it so if you do get the virus, it'll probably be less severe. But in any event, I hope that sort of answered some of that question anyway.
Definitely did. Thank you for that, Doctor. Next is from Mike in Carlsbad. The PPP loan program was advertised as a program for sustaining payrolls at small businesses. I suspect that most of the money went to companies with more than $1 million in assets. Are we ever going to know where the money went? Is the House going to subpoena the records and hold hearings? Well, Mike, it's an excellent question. I can tell you that until this week, that was the direction we were headed in. I think we had only received very broad and general data from SBA on where the money went. And, a lot of us really demanded that Secretary Mnuchin and the SBA provide a lot more data, as they do with the SBA's 7A loan program, as an example. And we also co-sponsored a bill in the House, the Paycheck Protection Program Transparency Act, that would have required the SBA to create a searchable online platform disclosing information on each PPP loan recipient. But there is some good news, which is that this week, finally, at long last, the SBA released data on PPP loan recipients. And as I mentioned, I'm pleased that over 20,000 of our local businesses in CA 49 received funds, and again, 241,000 plus employees in those businesses received support. But of course, we also saw the stories around where some of this money went. And I have great concern when I see some of this, that the money did not go to the businesses that really needed it, but rather to the wealthy and the well-connected. And we cannot allow that to stand. We've got to fight very hard for transparency and accountability. We've got to demand better out of the Treasury and out of the SBA. And I know that my friend, Congressman James Clyburn of South Carolina, he'll be conducting a number of hearings with his new select committee to oversee those funds for COVID-19. And he's going to get to the bottom of where all that money went and why certain businesses and others were preferred over those who may have needed the money the most. We've continued to make changes to the PPP. We put in law that $60 billion of the money had to go directly through community-based lenders, and that hopefully will help a lot of those underserved communities. But we still have, I think, $120 or $130 billion left in the program. And it's my great hope that by extending the deadline to August the 8th for the application, that we're going to have a fair and equitable process in the next month or so as we have the last of these funds borrowed. But not a perfect program, but one that nonetheless helped over 20,000 businesses in our district. Mary Beth in Encinitas asks, our country paid for the rebuild of many nations after World War II. So why can't the U.S. let our people stay home and give them enough money to live until COVID-19 is over? We spent billions in Afghanistan. How about here in the USA? Well, I could certainly sympathize with that sentiment. As you know, it's been difficult for us to find a compromise on stimulus support. We in the HEROES Act had sent to the Senate what we thought was a comprehensive proposal that met the needs of the livelihood and the lives, frankly, of the American people. And that's now been sitting on McConnell's desk for over a month because he seems content with inaction. And as we've said repeatedly, the pandemic is not taking a pause, and the Senate should not be taking a pause either. And at the same time, look, we've got this health crisis ongoing, and we've got to address it. We've got to continue to ramp up our efforts in every way, testing, tracing, the continued acceleration of the development of the vaccine, therapeutics, diagnostics, all need to be improved. We've learned a lot, but we still have a long way to go. And, you know, I will continue to reach out to my friends on the other side of the aisle, do everything we can to try to come together in this month of July and get that fifth bipartisan bill over the finish line, because people in our communities continue to be hurting and impacted by this. And the status quo of the Senate just sitting on our legislation, not taking any action, is simply unacceptable. Donna in Vista says, do we know when relatives can travel and come to California from another state yet? Well, Donna, California, to the best of my knowledge, is not restricting travel from anywhere to California. We may be restricted, I think, from going without self-quarantine from a few places. But look, staying home is the best strategy right now. I think the doctor would agree to that. And the CDC has all kinds of guidance for travelers at cdc.gov. But Dr. Steinberg, fair to say people shouldn't be traveling unless absolutely necessary?
That would be my recommendation. And right, to my knowledge, there's nothing that prevents anybody from coming here. But I think we are getting on the naughty list for certain other states, and that's, you know, based on the numbers and epidemiology and just safe public health practices. Michael
Valdez says the grant that was issued by the government to help small businesses is a temporary fix. Per the CDC guidelines, anyone who tests positive or exposed to someone who has the virus in the workplace would require newly opened businesses to close again. How do businesses survive with such handicaps in place? Well, doctor, if you want to tackle that, I can tell you on a policy side, you know, one of the hope of the PPP was that by expanding the ability to use it for up to 24 weeks and get full loan forgiveness, that we could adapt to the changing circumstances of COVID. The longer this goes, the harder that is, and 24 weeks no longer will work as intended, just as 8 weeks didn't work originally. So we're keeping a close eye on this. I can tell you I'm very concerned also about the unemployment insurance running out. And if we're not replacing it with another $600 a week, well, okay, what are we going to replace it with? And we have to have those discussions. We have to make sure that people are going to be able to continue to survive. Simple as that. Doctor, thoughts on this?
Yeah, I think the CDC does what they do based on the science behind it. And I think certainly if you have positive cases in a workplace, there's a reasonable, I mean, it's not unreasonable to say it's time to shut down temporarily. So it's another one of those situations where, you know, freedom and public health may be a little bit at odds, but that's certainly the safest way to go if you have somebody in a workplace to require to shut back down again. In some ways, it would have been better not to open them at all, because I think it gets people's hopes up. So it's really difficult. And, you know, look at schools too. You know, they're talking about, it's hard to imagine somebody in a position to say, we're not going to give your school money unless you open back up in person. I don't get that. We don't know what's going to be happening in September, but based on what's happening right here, right now, to me, it seems like it would be an exceptionally bad idea to mandate in-person school, right? But that's just my opinion.
Well, and I did see that your alma mater is suing the Trump administration, right? Joining with MIT in a lawsuit over some of those more draconian requirements. So it'll be very interesting to see where all this winds up. My belief, as I stated, is that, look, if schools are going to reopen and they have less money than they had before, all my discussions with our local superintendents suggest that they're going to need millions more to help with that reopening, to do it in a safe and responsible way to the extent they can. And here we are, not able to provide any additional state and local funding. So it really is a very daunting situation for our local schools and for our local school teachers and, for our families. And it really is tough to imagine that we're going to be able to get the economy back on track if people cannot send their kids to school and if childcare options aren't made more readily available. So that's why we need the resources there. Or we need resources of another type. If the pandemic will not allow any of that to occur, then we have to make sure that we provide the necessary resources that people will need if they have to remain at home. So we have to have a clear and consistent and thoughtful strategy here. And we just lack that. And that, unfortunately, that comes from a lack of leadership at the top. Leonard in Oceanside asks, how do we hold the Trump administration accountable for condoning Russian bounties on American service persons, not declaring a national emergency, and not adopting a national strategy to combat the coronavirus? What is your office doing to catalog all the illegal actions, obstructions of justice, and abuses of power by the Trump administration, and what work with other legislators to expose and stop these actions? Wow, Leonard, that is quite a question. What I can tell you is that we're in an incredibly challenging situation when the President of the United States openly will reject congressional oversight, will disregard subpoenas, will encourage his administration to turn the other way. It's very hard in that manner to conduct oversight. And then, of course, you have journalists out there trying to get to the truth. And when, of course, they report anything that's negative about the administration, they are called the enemy of the people. This puts a lot of challenging circumstances in place. And, just my own experience trying to get this administration to respond to anything has been hard. We knew that the administration was not forthcoming with a national testing strategy. This is something that's been of great concern to me. And so we sent letters to the White House Coronavirus Task Force and everyone else demanding that they do so. And in fact, we put it in legislation that they had to do so, following a lot of the letters from myself and other members. And unfortunately, we really haven't received anything even approaching a strategy, just deferred responsibility to states and really punting when it comes to things like procurement of PPE and things like swabs that are needed for diagnostics, reagent, and other things needed for our diagnostics. And as Andrew Cuomo said really well, I thought, if you're going to pass the buck, you better pass the bucks. And that hasn't happened either to the extent that it needs to. So what we see is a disregard for really the intent of our founders, which was to provide Congress with clear oversight responsibilities over the executive branch. We're going to keep at it as best we can each day. I can tell you these reports of bounties are unbelievably troubling to me. And we must demand that we get to the bottom of it. We must demand that every senator, every member of the House, whether they be Democratic, Republican, who cares? This is our country. These are our troops. We've got to get to the bottom of what happened. It is entirely unacceptable that either the president wasn't briefed on something like this or that he chose not to read his presidential daily briefing. Either way, it's incomprehensible to me. We need to know what the president knew, when he knew it, and what he did or did not do about it. And we can't stop until we find that out. And that's what we're going to do. Patrick in Carlsbad asks, what is the Department of Veterans Affairs doing about high-risk veterans for COVID-19, especially with testing? What kind of readiness does the VA have with respirators and hospital beds compared to the at-risk numbers? Is the San Diego VA prepared for overflow of patients if the numbers get worse? Well, Patrick, I get briefed on this all the time from Secretary Wilkie and from the head of VHA. And as of July 7th, 56% of acute care beds and 40% of ICU beds are occupied at VA facilities nationwide. VA has about 7 million N95 masks on hand. And when a facility becomes overburdened during the pandemic, VA has generally transferred non-COVID patients to other VA facilities. And the CARES Act provided $16 billion to the VA to support an increase in healthcare. They haven't spent nearly all of that. In fact, we need an accounting of why they haven't spent more of that, given the increase in hospitalization, ICU use. So we're just going to keep at it. We're going to keep monitoring everything the VA is doing. I've got a great working relationship with the folks at our local VA. They're working hard. A lot of these are new and challenging circumstances for them, but we'll continue to build on that partnership in service of our veterans. Gary in Carlsbad, here's a question about songs. So get ready, Greg. Who owns the song site? What is the estimated date to rid the site of all the contamination, and what is the zoning for the site? I'll start, Greg, and then if you want to add on, it's primarily owned and operated by Southern California Edison. The major issue with the spent fuel on site is there's nowhere to send it. It's really the problem, or the symptom, I should say, of a bigger problem. The symptom is the San Onofre waste. The problem is we have no comprehensive strategy to deal with all of our nation's spent nuclear fuel throughout the United States. And we're trying as best we can to solve that. There's a number of legislative efforts, the Store Nuclear Fuel Act, that would allow the DOE to partner with companies that want to build interim storage sites, and our Spent Fuel Prioritization Act, as I mentioned before. And the SOGS Task Force report included a number of recommendations on this topic. So I will turn it over to you, Greg.
Well, thank you, Congressman. Yeah, I think, this is a challenging issue as we've talked about. And when it comes specifically to the site, the cleanup time frame, typically a nuclear reactor, once it shuts down, has about 60 years to finish doing all the cleanup at the site. And the way that system was designed, there was never an expectation that you would have this spent nuclear fuel there that really wouldn't have a place to go. So the owner is allowed to take up to 60 years, and Songs actually Edison is moving more quickly than that, and likely will actually complete the decommissioning of the site in a decade or more, or decade, 1 or 2 decades, which is relatively fast compared to some other sites. And by regulation, they're required to actually essentially convert that back to the condition it was before that plant was ever built. So that's the good part of the story. The more challenging part of the story is that there's now this waste that's been buried in the ground, or is being buried in the ground as we speak, and there's no real plan for what to do with that waste in the future. And we know that through technical studies and other examinations that fuel can't stay there permanently. So it will need to be moved at some point. And so all the decisions that are made today really need to be geared toward that idea of how do you ensure that fuel can be maintained safely and securely and protect the population, protect the environment. And there were, as you said, a number of recommendations of the task force that address that. But right now, the answer really for the fuel itself is indefinitely. There really is not an answer beyond that. And that's one of the challenges, and why I think it's great that you've taken this on as an issue, because a solution that works for the community in Southern California that you represent hopefully can have some implications and applications for communities throughout the rest of the country. And we can finally figure out a way to really deal with this issue.
That's our great hope, Greg, and we're just going to keep at it. Sylvia has a related question. She says, I have been reading how nuclear power is the cleanest way to get to zero emissions and least impact environmental concerns such as animal habitats. What is being done to make nuclear power safe? Well, Sylvia, I would say that partially that's true, but the biggest problem is we don't have anywhere to send the nuclear waste created by one of these plants, and that's a massive hurdle that can't be dismissed. And we know that all too well, given what we see at San Onofre. So, there are plenty of other renewable energy sources that do not have a toxic waste issue, and I'm going to do everything I can to promote those. And in fact, you talk about public lands and environmental preservation. In our work on the House Natural Resources Committee, I'm leading a bipartisan bill called PLREDA, Public Lands Renewable Energy Development Act, that would create 25 gigawatts of new renewable energy, solar and wind and such, on our public lands in an environmentally responsible way, with great input from the environmental community by 2025. So that's an example of something that can be done that doesn't have that waste footprint. And look, there are places where nuclear may make more sense, but along the California coast with earthquake faults is not one of those places. And I'm all for innovation. I'm all for research, development, and things like small modular reactors, where potentially you could reuse the spent fuel in a productive manner, or fusion is always, as they say, today's science fiction is tomorrow's science fact. So you never want to preclude that. I'm all for research. That's part of our report as well. We also need new research on what to do with the waste. And that's, I know, one of the recommendations as well, Greg. But you want to elaborate on the promise and peril of nuclear?
Well, yeah, I think you touched on a lot of the important issues. Really, it depends how you look at the question. What is really the most environmentally friendly way to generate electricity? I think the way I always like to tackle that is just to say that there really is no environmentally friendly way to generate lots and lots of energy. The most environmentally friendly way to do it is to save energy and use energy more efficiently. Beyond that, everything else has some implication and some impact on the environment. So the advantage of nuclear and renewables is that they don't emit carbon dioxide when they generate electricity, which is really a crucial problem right now. So, right now, nuclear has challenges. The biggest challenge it faces from beyond the spent fuel issue is the fact that it's expensive, and it's more expensive than many of the other technologies you talked about. So people are looking at ways to deal with the safety risks and the safety hazards of nuclear power. Ideas like smaller reactors, because of course the smaller the reactor is, the less, really ultimately, the less radiation you can release to the environment. They're looking at ways to fundamentally rethink the nuclear process within the reactor and how that energy is extracted, so that you can have the risk of a catastrophic nuclear accident like you saw at Fukushima. The problem with most of those solutions is people have been looking at them for decades, and the problem we're trying to address really is climate change, and the solutions we need for climate change have to really start in the next decade, and in a really, really significant way, and more significantly than we're doing right now. So the time may just be running out for some of these newer ideas, and the money may not really be there ultimately for them to be cost competitive, because as every day that goes by, solar becomes cheaper, wind becomes cheaper, battery storage becomes cheaper, geothermal, which is a great resource in California, becomes cheaper. So the alternatives are getting cheaper. Nuclear may or may not get cheaper. And then you still have the issue of what to do long-term with the waste. So, there are challenges to it, but there are ideas that people are looking at and working on to try and improve upon the problems with nuclear to really take advantage of the benefits of nuclear.
Well, I think that's really well said. And Sylvia, if you're really interested in getting in the weeds on this, there's an entire section in the Climate Crisis Action Plan that we helped to write on nuclear, outlining a lot of these issues. And of course, it mentions our Spent Fuel Prioritization Act and other efforts to try to deal with the nuclear waste issue. But no question that the other thing, that the big challenge is that among our current power grid, nuclear makes up a huge percentage. I think something like 45% of the current zero carbon emitting assets. And so we've got a whole fleet of nuclear plants that we're going to have to figure out what to do with, whether we relicense them or not. And then, of course, there are others like the ones in California that are not moving forward. But then we've got a massive challenge around waste at the roughly 130 or so sites all throughout the United States. So it's one of those things where, Greg and I, we're still relatively young, but I have a feeling we'll be working on this for a long time. Definitely will be keeping us busy. Turning back to COVID, Marilyn in Oceanside says, I would like to know how the mask mandate will be enforced. With so many people ignoring it and abusing employees and others that ask them to comply, what more drastic and compelling measures will be taken to ensure that mask wearing isn't considered optional? Will fines be implemented with a task force to do it? I know with certainty if I park in a metered parking spot for 5 minutes beyond my time, I will get a ticket. Why wouldn't a life-saving measure be enforced as well? Well, I really, really hope that it doesn't come to this. But as Dr. Steinberg said correctly, politicizing wearing a mask, I mean, something so simple as putting a piece of cloth over your face, we know that it dramatically reduces transmission of a potentially deadly and highly infectious disease. Like, why wouldn't we all just do the smart thing to keep each other safe? It's basic respect for our fellow human beings. So mask or whatever else that we'll get beyond this crazy politicization of wearing a mask. That being said, I do know that it really is a mixed bag in California. Some law enforcement agencies are willing to, enforce the mask wearing with a misdemeanor or a fine or some other penalty, and then others say that they're not willing to enforce it. It's very important who we elect at the local level as our county representatives, as our city representatives. And so if you don't like the way that it's being enforced in your jurisdiction, I suggest you get involved and you make that known with your local elected representatives. I would say also that OSHA, the California Occupational Safety and Health, they can also, go in and shut down businesses that aren't adhering to the rules. And I've seen some of that happening. And I hope just the same that wouldn't occur, because ultimately that's going to hurt that business. So much smarter to follow the rules if you want to stay open. We know that it works, and why somebody wouldn't want to stay open and try to do business in a safe way is just beyond me, but it is what it is. Anything else on the wearing of masks, Dr. Steinberg?
No, I think, if it were enforced, people probably would be more likely to comply, even if it was a bit of an inconvenience, or even if it was a bit of a philosophical, for whatever reason they don't want to follow it out of sheer selfishness or ignorance or whatever else it might be. But our country, it's all about freedom, and so I could see both sides of that. I would be fine with them writing citations for that, right? I mean, if you speed on the highway, you're doing it, you're taking a risk, you know that you're not supposed to do it, or that at least there'll be consequences if you do it. So I think I wouldn't be against it at all. But like the congressman said, I think it's a matter of exactly where you are and who's in charge of enforcement.
Thank you, Doctor. Richard in Dana Point has two questions that are somewhat different, but we'll try to address them both. First, I'm interested in your position on defunding law enforcement agencies, looting, burning, and injuring citizens in the name of the First Amendment to protest, and defacing and destroying historical buildings, statues, and monuments. Also, what progress has been made regarding off-site storage of San Onofre spent fuel? We'll get to San Onofre in a second, Greg. But look, I don't support defunding law enforcement. Reform, absolutely. And we've laid a lot of those reforms out in the George Floyd Justice and Policing Act. But look, the protests that we've seen in response to the killing of George Floyd and the Black Lives Matter movement, that's part of the process to enact change and to uphold First Amendment rights. I think is critically important to the future of our democracy. I stand with peaceful demonstrators across the country. Of course, we don't stand with anybody who's trying to take advantage of the situation or act in a violent manner to try to define otherwise overwhelmingly peaceful protests. But I think at the end of the day, my great hope is that we can take this moment and not be further divided, but hopefully try to seek common ground around a new normal. And that continues to be my hope. And I think that's what the overwhelming majority of people in this country want to see. And that's what we're going to aspire towards. As for the second part of your question, as I mentioned previously, we introduced the Spent Fuel Prioritization Act to try to help to ensure that San Onofre is at the very top of the list when we actually identify and secure a site where waste can be sent. And look, there's a number of other recommendations about the types of sites that we're going to need, the process that we're going to need in order to make that happen. And perhaps, Greg, you want to spend a minute and talk about some of your recommendations.
Sure, and there's certainly a number both at the state and federal level. And I think focusing on some of the federal things that need to happen, it's become clear that the Department of Energy has just not been an effective steward of the goal to find a national nuclear waste repository. And so one of the recommendations we made was to create a new national or federal organization that would be solely dedicated to dealing with this issue of finding a place to permanently deal with the nuclear waste. And I know that's something that you've indicated you'll be looking at dealing with on a congressional level, because it would take congressional action to create this new organization. But I think that would be a very important step to give focus at the federal level to an agency just dedicated to dealing with this problem. And I think that would be a significant step forward. We also have recommendations dealing specifically with the current situation at SONG. So how can this situation be made better? Well, we have recommendations, for instance, in better training the workers that are dealing with the movement of fuel, in putting in place better requirements and standards for the monitoring and examination of the fuel to ensure that it's not degrading over time, that it's not releasing radiation inappropriately. Those are some of the kind of from the broad, big picture, really driving the decision making down to the very specific. But as we speak, the fuel continues to be put into the canisters or into the storage configuration in the ground, and that I think is unfortunate. But hopefully, over the long term, alternatives will be found that can allow that fuel then to come out and go to a long term better place than currently.
Thank you for that, Greg, and thank you also for bringing up the need for a new nuclear waste administration. That's something we're going to fight for in the months ahead. Switching gears back to COVID, Drew writes, the New York Times stated that nursing homes across the country are kicking out old and disabled residents and sending them to homeless shelters and rundown motels so they can be replaced with COVID-19 patients who are more lucrative for the nursing homes. To your knowledge, is anything being done to protect nursing home residents from being evicted so they can be replaced with more lucrative COVID-19 patients, and to protect them from patients coming in with COVID-19? And Dr. Steinberg is our resident nursing home expert. I will turn to you for your response.
Yes, I read that article, and I think there are definitely some facilities that have done that. I think the article's probably a little bit overly sensationalistic and a little bit overblown. And I think if you remember part of this article, if I'm remembering the right one of the residents that they essentially evicted or sent out was, went to stay with his niece, and she woke up and he was, brandishing a knife over her bed or something like that. And I would submit that guy probably, if you had a mom or a grandma in a nursing home, you probably wouldn't want him in there with your mom either. Nursing homes these days are taking care of a lot of people with serious mental illness. They're not your grandma's nursing home. It's the traditional population of long-term care has changed a lot. In spite of that, I think there is a real concern that some bad players, and I want to emphasize that in my experience in the nursing home industry, bad players are a small minority where it's, they're all about profit, and they may be trying to open up beds that are compensated at a higher rate. I have not personally witnessed that happening. And I just think it's so easy for the media to really demonize nursing homes. Something just came out in the San Diego media today, and it was a story about how nursing homes are not meeting the recommend or the required staffing levels that researchers think are required, and trying to conflate that with COVID cases and saying that because facilities are don't want to pay money for staff, that's why they're getting more COVID. And I think that's a gross oversimplification. There's a huge workforce shortage right now. And right now, if you're a nursing home and you have some people who are out sick or out on stress leave, and you've got to pay a registry, I mean, they're paying, $100 an hour or more for a nurse. And anyway, I'm rambling a little, wow. But I would say that nursing homes, for the most part, are doing absolutely the best they can. And I think the people on the front lines there need to be recognized as heroes. You always see the people in the hospital, and these nursing homes are taking care of exceptionally sick people. And I think a great majority of them are doing what they can to do the right thing. I can say that about the facilities where I'm looking after people. They put resident well-being first, and then they put staff well-being close to that. And of course, they need to turn a profit to be able to stay viable. But anyway, that's my experience, and I hope that answered the question. I know there have been cases where that's been documented, and I believe facilities that do put people out who really belong there should be held accountable, and they are. They're getting nailed. They're getting big administrative fines, and some of them are even being shut down. So. Anyway, it's a tough place to be right about now, and your prayers would be appreciated for people who both work and live in nursing homes.
Well, we certainly are very grateful to everyone that puts their own health and safety at risk during this time to work on the front lines. That certainly includes our nursing homes and all of our doctors, our nurses, and not just our RNs, but our LVNs, our CNAs, and everybody that really, really goes above and beyond, working hard for others during this time. We're just truly grateful to them, and we need to be supportive as possible. And of course, holding bad actors to account is very important as well. Matthew asks, COVID-19 is currently ravaging the health and economy of developing nations, threatening to throw millions further into poverty. Do you think Congress should do more to protect these impoverished nations from the pandemic? Well, my first priority has been, will continue to be the health and well-being of everyone in my district. But that being said, yes, I absolutely think that the United States should not be ceding its global leadership on public health. And I think that withdrawing from the World Health Organization was the wrong move. We'll see what happens in November, but if we have a new president, that new president can decide not to follow up on that and can get back in the WHO. My statement is very simple, which is that, look, if we're upset with what the WHO may or may not have done, that's one thing, but don't abandon the organization. Try to improve it. Try to work with our partners across the world and try to be a global leader again, rather than going it alone. I think it's so critically important to acknowledge the importance of the United States as a global leader, whether it be on public health, on environmental and climate issues, or so much else. And I worry that by saying we're going to be isolationists, we're going to withdraw from all these other international agreements, that we're doing a massive disservice to our nation and to our historical leadership role and our respect around the world. Again, our leadership in the House, we have stepped up and we've said that we want to support other nations. I think that's the right thing to do. And we've got to get back to a position of global leadership again. Diana in Oceanside asks, what can Congress do to address long-term senior care needs brought to attention during the COVID-19 pandemic? Well, in the CARES Act, we actually did do a number of things. We tried to provide forms of economic assistance for long-term care providers, nursing homes, trying to cover lost revenue, trying to, fund things like personal protective equipment and and staff overtime and testing and the like. In the HEROES Act, we went far further than that, and I think it's critically important that as the Senate consider its version of the HEROES Act, or whatever it is that McConnell is set to introduce, that they don't forget about the needs of our long-term care in nursing home facilities that have been so hard hit by this. I really hope that they are top of mind. And I've also advocated, and I know Dr. Steinberg is a proponent of establishing a registry of nursing home medical directors to improve oversight of that key position. Also, we're going in the wake of the pandemic, we're going to need to do a lot more with regard to telemedicine and also televisitation to make sure, as Dr. Steinberg said, if people can't see their loved ones directly, that we try to make other means available to people to see their loved ones while in-person visits are being suspended. And then we need a lot more data collection. We need a lot more technical assistance, and the HEROES Act goes a long way towards all of that. And Dr. Steinberg, is there anything else that I missed that you'd like to see?
Yes, I would say, in terms of basically long-term supports and services, I think, beyond the institutional setting, I think it would be nice to have additional funding for people to be able to stay at home and get assistance at home. And some of that in our state budget has recently been slashed, and it's still being worked out. But to the extent that people don't have to be in an institutional setting, we'd much rather have people be able to stay at home. So that's one thing. The other thing is that, your tax dollars with Medi-Cal or Medicaid in other states will pay for somebody to live in a nursing home, which is, $100,000 a year. And just because they need assistance with a couple of their activities of daily living or something like that. So we'll pay for that, but we won't pay for that person to live at a small 6-bed mom and pop board and care, group home facility, or what we call residential facilities, residential care facilities for the elderly here in California, where instead of $10,000 a month, it might be, instead of $100,000 a year, maybe it would be $36,000 a year. We could save so much money if we were allowed to do that kind of a Medicaid or Medi-Cal waiver. There's a limited number, just a few thousand, that are allowed in California right now. So that's something I would certainly, it's one of my talking points when I talk to legislators is, I don't know about you, but I would much rather live in a 6-bed facility, getting home cooked food, 2 caregivers to 6 residents, as opposed to being in a 150-bed nursing home where there's a bunch of sick people and also a bunch of these younger ex-convicts with serious mental illness, throwing around F-bombs, and I'd rather not be there. I'd rather my mom not be there. So anyway, that's another place to look.
Fair enough, Doctor. Fair enough. Bailey writes, as a teacher, I am concerned by the effect COVID-19 has had on our economy and the toll that it is taking on our public education system. I agree with that, Bailey. Having students physically present in school is not only essential to the well-being of children, but also for working parents. Now we are facing decreasing budgets and increasing demands to keep schools safe. What efforts are you making to ensure that funds allocated from bills like the CARES Act help schools and students who need it the most? And can public education count on you to support additional relief at the federal level to keep our schools safe and open? Couldn't agree with you more. And yes, you absolutely can count on our office to do everything we can to fight for our public schools and for our public school teachers. Look, I have 2 kids at home, my wife and I. They're 8 and 6. They attend our local public school. And I know from our conversations with the leadership in our local district that this pandemic has taken a huge financial toll on the district. And to the extent they're reopening, which they're planning to do, they're offering options to parents like my wife and I to send the kids back full time or to do 50-50 with online, or to do all online. And some parents will not be able to do the online because their work demands require that they're free during the day, and so a number of children are going to have to go back, and that means that our schools will need more resources, not fewer. The estimates are in the millions and millions of dollars in the discussions that I've had with our local superintendents. And so to turn our backs, while demanding that they reopen, to turn our backs on our state and local governments that help to fund our public education, to me is despicable. And that makes no sense whatsoever. So yes, the HEROES Act, as I said, $875 billion for state and local government. And important, it would allow for not only direct COVID-related expenses, but revenue recovery. And that means the public schools would be able to get more than they got in the CARES Act. In the CARES Act, they did get some funding. It was based on Title I eligibility. Some districts did better, some did worse, but it wasn't enough. Simply wasn't enough. So it's all the more reason why we've got to keep pushing the Senate to pass the HEROES Act or something like the HEROES Act. I've written leadership. I've written anybody that will listen, demanding that we do this. And the HEROES Act, I think, would go a long way towards helping, and we've just got to keep pushing McConnell to get it done. Jeffrey in Rancho Santa Fe says, do you think the COVID-19 pandemic makes absentee voting, voting by mail, something that Congress should address, especially with funding for those locations with egregious voting inequalities? Well, Jeffrey, I was disgusted to see some of the recent lines and the situation in Wisconsin and some other places where we've seen people having to choose between their health and voting, exercising their democratic right to vote. That should never happen in the United States of America. So I have been a strong proponent of vote by mail, and that was long before the pandemic, but I think it's even more important now, given the health and safety challenges that we face. I am proud to live in California, where we have a Secretary of State, Alex Padilla, who wants to make sure that everyone who is legally eligible to vote has the opportunity to vote, and that it's easier, not harder, to do so. We want to encourage people who are legally eligible to vote to do so. That means we want to avoid any effort to suppress the vote. We know those efforts have ramped up in the wake of the Shelby versus Holder decision a number of years ago. We passed in the House H.R. 1, the For the People Act, and H.R. 4, the Voting Rights Advancement Act, to try to get back to the spirit and the letter of the Voting Rights Act. And I'm honored to serve with Congressman John Lewis, who was there from day one when the Voting Rights Act and the Civil Rights Act were being enacted. It's the very least that we ought to expect of our democracy. If we claim to have the greatest democracy in the world, for everyone who is legally eligible to vote to be able to do so without worrying about their own health. Very basic national vote by mail, period, end of story. And there's no evidence whatsoever. The largest study on this was done by Loyola Law School, and it showed virtually zero fraud as a result of vote by mail. So that's complete nonsense as well. Well, with that, we've gotten through most of our questions here. We're just about out of time, but I want to give each of you an opportunity for closing remarks. And Dr. Steinberg, since you went second before, we'll have you go first and talk about COVID-19 and concluding thoughts this week.
Fair enough. I don't really have much to add beyond what we've already talked about. I just encourage everybody to try to be patient and continue to do the right thing. Don't do indoor gatherings, stay 6 feet or more away from people, wear a mask, wash your hands, don't touch your face. Say a prayer for people working in nursing homes and our elder population, and just try to set a good example for others. There are going to be plenty among us who are not going to want to do that, and I don't wish them any ill will. I just the ignorance and kind of irresponsibility saddens me. But I hope our numbers will start to get better soon. And, we are really worried, I think, in San Diego County in particular, that our hospitals, over the next 4 to 6 weeks may reach capacity. And We spent a lot of time early in this pandemic making sure to, produce more ventilators and things like that. And of course, it turns out if you land on a ventilator with COVID, you're probably cooked anyway. Your prognosis is very poor. We really should have spent those resources doing other things. But we can still do stuff now, and we can just try to stay safe, not put others at risk, not put ourselves at risk, and be patient, stay the course. Thanks for having me.
Thank you, as always, Dr. Steinberg. It's wonderful to see you, and thank you for, again, the 9th town hall that you participated in. You are setting a great example by providing all this terrific information, answering all these questions from our constituents. So we're truly thankful to you. And Greg, equally grateful for your hard work with regard to our spent nuclear fuel issues in general, and specifically the challenges we face at San Onofre. Do you want to spend just a minute and sum up the work of the task force and where we go from here?
Well, sure. I think first off, I encourage everyone to get a copy of the report and read it. I think it's available through your congressional website, and look at all the recommendations. The report we wrote hopefully in a general enough way that anyone without technical knowledge and technical expertise could read it and access the recommendations. So I think the report gives a roadmap for how we can improve not only the current safety of the spent fuel at Songs, but also address the long-term need to find a good solution for the fuel. So it was a pleasure to work with a number of people in the community, and really the report comes down to their hard work and their contributions in looking at these issues and making informed recommendations that we ultimately were able to come together on in almost a unanimous fashion. So I think it provides a really good roadmap and a place to continue to move the ball forward on this issue. So I encourage everyone to read it, and certainly let me know if you have comments about it. I'd be happy to talk to anyone about it and continue to see how we can refine it and make it better and get this problem solved.
Well, thank you so much, Greg. And achieving consensus among this group was no easy task. So I'm very grateful to you and Lynn and all of our task force members for all their great participation. And we do have so much to do on this issue. But I am absolutely convinced that if we work together and we just try as best we can to chart a course towards success, that we're going to get there. I want to thank both Carl and Greg for their participation, their friendship, their hard work on behalf of our community. I hope that this was informative for you. I hope that you do follow all those public health recommendations. We sort of sound like a broken record, but wear a mask, socially distance, wash your hands, do all those other things that we know help control the spread of the virus. Stay safe, and also let's do all we can in this moment to show the best of who we are, our kindness, our generosity. Let's do all we can to get through this together, and hopefully we will have a better day soon ahead. Until we see you, thanks for tuning in, and take care.